our staff who've all worked so very hard on this program, our planning committee, Mark Johnson in our office, Barbara Giles, she's the person you see outside to fill out your little slips for the door prizes, Joe Zapata, and from the VA, Elizabeth Packer, Veronica Salazar, and Tressa Carr. And in the back of the room, we have a stream team. This conference and tomorrow's conference are being streamed live on the internet to other folks who are listening in who couldn't be here. And that team's led by Bob Merrill, and back there with him as well are John Munoz and Kelvin Buchanan. So thanks to them. And do you want to do, okay. So
they've slipped out. Got it.
Russell, what are you doing?
I'm getting ready for the next presentation because it's on hydration and nutrition and exercise.
Okay, that was very clever. But I think you're going to get better information from our presenter, Kelly Dunn. She's a certified public health nurse, and she conducts research in aging and fall prevention, cognition, and improved functional fitness. Please welcome Kelly Dunn.
I just want to make a comment about Don Royal's presentation. I think we should start calling him the neurinator, because I could just feel my neurons changing as he presented. I have a long history in public and community health nursing and working with clients in the community, populations usually providing care to individuals to improve the health of the whole population. So I've done research on physical activity with African American women, Mexican American women, and just older adults in general, and have a lot of information about what they think about physical activity and what it will do. And then in terms of nutrition, I'm very interested in nutrition because I myself suffer from a little bit of overweight, right? I mean, this could be aging. Don said, what is aging? I can tell him. It's wrinkles, it's a little bit of overweight, it's a lot of things that happen to us as we get older that we're not too happy about. But anyway, today I want to give you some information, up-to-date information about these topics. So what should people eat and drink? How do elders eat and drink differently from us who are younger? Can they prepare their food, or can't they? If not, who does it? And what are some of the fads that we're hearing about? What is some of the new science? How are elders eating? So every time a senior comes to your office or you go to the community to see a senior, you should be conducting a mini nutritional assessment that checks their weight, because weight change is a very good indicator that something is wrong. And weight loss is a sign of the fact that they're not eating or that they're deteriorating. Ask if they have any problems chewing or swallowing. Always check their dentition too, because there could be something wrong with their teeth. And you have to ask them if their bite is okay, if they're chewing okay, if they're seeing a dentist. And then who prepares their food? Do they? Can they? Are they eating cans of soup? And how good is it to eat just soup all the time for supper? I'm thinking of my mother who died in February and lived independently until she was 93 and prepared her own meals. And I saw the weight decline and the eating the soup out of the cans because she was too tired to do anything else. She just wasn't interested in food. And so always find out how people are cooking and who they're eating with or who's cooking for them. You know, we tend to look at eating as a social activity in our culture. it is in probably every culture, but if you live alone, if an elder lives alone and they're eating alone, are they going to eat as well as if they had someone with them? And how can we encourage communal eating in places like senior living apartments? Because they have their own little place, they're probably reluctant to leave their room. If they're immobilized, they can't leave their room. So how can we find ways for them to be social during meals? And of course, if they're inactive, they're not going to have much appetite because they're not burning calories. Maybe they're just snacking all the time on food that's convenient, easy to grab. Goldfish is my favorite. But if they are, how is that affecting their nutrition? And alcohol is a big issue for elders. If they're drinking a lot, they're not going to eat much. So you have to do some sort of alcohol intake assessment. I guess the cage is one you could use. There are several. Always ask if they're under any kind of stress or anxiety, or if they've been recently ill, because that will change their appetite and their eating. And then, of course, dementia. If they're demented, they're less likely to be able to manage the whole issue around food. Remember that you can measure their waist and pretty well tell if they have too much fat, which is a certain risk factor for all kinds of conditions, including heart disease and diabetes. So here's the recommendations for adults. 4 servings or 2 cups of fruit and 5 servings or 2.5 cups of vegetables daily. And don't include white food. Remember, that's that new diet, no white, I don't eat white. And then people should be eating fish twice a week, because of the omega-3 fatty acids. And if they're not, they should be taking something like fish oil capsules. Nuts, such as walnuts, flax seeds, and canola oil also will provide omega-3, among others, olive oil, etc. So we can teach people, but we can't make them increase their intake of whole grains. And have you noticed how difficult it is to understand food labels? You see bread that says 7 grams of whole grains. Well, what does that mean, really? How can we interpret that? We should advise our elders to take a multivitamin and to supplement calcium with magnesium taken at meals. I don't know how many of you are taking calcium, but calcium can be very constipating, so that's why the magnesium. But also, chronic constipation is a huge problem in aging and something we need to deal with in terms of keeping people healthy. Vitamin D, all the nursing homes are giving vitamin D now to prevent fractures when people fall. It seems to have an effect on reducing falls even. And there's the fish oil. Iron's less likely to be necessary, but you want to make sure that all of your elders get assessed for a B12 deficiency, for pernicious anemia, so that they aren't affected by that. The Mediterranean diet is considered very healthy, the right way to eat. So here they've added daily physical activity at the bottom. I guess I could use the pointer. You can see it's based mostly on whole grains, potatoes, corn, polenta, bread, pasta, fruits, and vegetables. And then meat is at the top, red meat, but poultry is closer to the bottom, and fish is a very prominent part of the diet. Cheese, yogurt, and olives. And of course, water and wine in moderation. I think to the food pyramids that we now have My Plate, so we don't have pyramids anymore. But in addition to the food pyramid, there's also a physical activity pyramid I'll show you. And I also think we should have a cognitive activity pyramid, because without being active with our brains, we're going to be affected in terms of our ability to stay physically active. Once you're demented, you don't have the motivation to go exercise. So we need to preserve cognitive activity too. So flavonoids are a large family of polyphenolic compounds that are synthesized by plants. And they're really, apparently the newest research says that they're not antioxidant, they're really changing cell pathways, cell signaling pathways. And I want to refer you to the Linus Pauling Institute, which has a wonderful website on micronutrients in nutrition for optimum health. It's very detailed, very scientific, very well researched, and very well discussed. So in order to be able to have a lot of these flavonoids, you have to eat color. So be colorful in your diet selections. The pastries we ate this morning were delicious, but we should have chosen the fruit because it had more color. And less fat, of course. But that's how you can talk to your patients about eating, is to make sure you eat a large variety of colorful foods every day. Higher anthocyanin intake is associated with lower arterial stiffness and central blood pressure in women. This is a study that was just reported this year. And so what's anthocyanin? Chocolate. So apparently we should all be eating some dark chocolate, probably as much as we like. They have found a better health among people living in Netherlands who drink a lot of cocoa. And chocolate is supposed to be reduce cardiovascular risk. So I think we should all take that in hand and do it. Now, of course, there are other things like our genetics and our exercise and all of that, but we can certainly keep a little bag of those Dove nuggets in our freezer so that whenever we want one, we can just open the freezer and get one out, although one isn't often enough. So chronic ingestion of flavonthiols and isoflavones improves insulin sensitivity and lipoprotein status, and it also mediates the 10-year cardiovascular risk in postmenopausal women with type 2 diabetes. So if we take care of eating the way we should, then we should be able to improve our disease risk as we age. So insulin sensitivity is a big issue and apparently improves greatly if you're just even a little bit more active than you are usually. I don't know how many of you regularly exercise, but even walking for a few minutes every day will improve your insulin sensitivity. And you won't be as hungry or have that gnawing hunger, you know, that deep, deep hunger that you feel. So we can reduce our heart risk as well. Jennings, here's a little bit more about the Jennings study. It was cross-sectional, and it was 1,898 women. And they measured their arterial stiffness, their intima thickness, and blood pressure to determine these associations with cardiovascular outcomes. And they used food frequency questionnaires to determine their antioxidant intake. So using the food frequency questionnaires and the USDA supplied information on micronutrients, flavonoids, and all of the other antioxidants, and there are quite a few of them, they could establish a quantifiable amount of antioxidants that the women ate. And then they measured those other cardiovascular variables. And they came up with the idea that, in fact, CV risk would likely be reduced because arterial stiffness, intima thickness, and blood pressure were better in women who ate more of those brightly colored fruits and vegetables. And the Hooper study, also this year, 42 acute or short-term chronic randomized controlled trials. They did a review of those 42 randomized controlled trials with 1,297 participants. And they measured insulin resistance and found that it was improved by chocolate or cocoa. And it reduced serum insulin. The dilatation of the arteries was improved after chocolate, and whether it was chronic intake of chocolate or acute intake of chocolate. And these reductions in blood pressure and mean arterial pressure were significant at every level. Had some effect on their low-density lipoprotein, which is the bad protein, but it raised the high-density lipoprotein. So that's the good lipoprotein. Now, some of you know that there's also those fluffy high-density lipoproteins that are supposed to be as bad as the low-density lipoproteins. Does anybody have information about that they want to add? No? Okay. Well, when they do a fractionated cholesterol test, they can test for those. It's an extra charge, but they are destructive. And so even if the high density is high in some people, they may have some of those fluffy high density lipoproteins that will damage or create a greater risk for heart disease. So chocolate or cocoa improved many things that are related to cardiovascular risk. And what's interesting about this is that this wasn't just one study. This was a review of 42 studies. So we have a pretty good idea that we should be eating chocolate from this. Remember when that email went out about chocolate as a vegetable? Well, it really is, isn't it? It's doing good things for people. Okay, here's another article on diabetes and cardiovascular disease risk in postmenopausal women with type 2 diabetes. And mostly, this was just a one-year randomized controlled trial. So the women were entered into this study, 93 of them. For a year, they were followed. They either were randomized to one of two groups. They took 27 grams of cocoa a day, chocolate a day, or they didn't take anything. They were given something that looked like chocolate but wasn't chocolate. They had a high dropout rate because I guess the stuff that looked like chocolate but didn't taste like chocolate was not satisfying. So a lot of the people in that group dropped out. This intervention, so this is the gold standard for research, is a randomized controlled trial where you have a placebo group or someone who gets usual care and an intervention group where people are given a special kind of treatment. And these women were given the chocolate. So they found that there was a significant reduction in insulin resistance, and it improved their insulin sensitivity, and they also had reductions in cholesterol. So, you know, you always heard chocolate was really bad for your cholesterol. Well, no, it's not. So it says it even reduced the low-density lipoprotein, which is the one that causes problems. Okay, growth hormone therapy. How many have heard about growth hormone therapy? Have you seen the sign on Medical Drive that says growth hormone diet? I always wondered what's going on in there. I guess they give you growth hormone to lose weight. But I couldn't find anything in the research about growth hormone promoting weight loss. Does anyone have any evidence that growth hormone promotes weight loss? And it doesn't really make a change in your lean body mass, and that's what we all hate about getting older, is that we get more body fat. We're not as lean as we used to be, and our muscles aren't as strong as they were. We don't have the same strength or endurance or flexibility, and apparently growth hormone doesn't really affect those. And high levels is associated with a greater risk of cancer. So I guess it wouldn't be something I'd want to take.
You know, they're using the HCG hormone.
Oh, human chorionic gonadotropin.
But I've never heard of
Just the growth hormone.
yeah, not the growth.
Yeah. Anybody know about the human chorionic HCG? Gonadotropin? Anybody know about that? Not much, just the word.
They're losing weight with it.
And people are losing weight with it, apparently. Now, isn't that the hormone that they test for when you get pregnant?
Yes.
So does that mean if you... I don't know how to interpret that. Can you interpret that? Human chorionic gonadotropin,
It works.
the hormone that... So what does it suppress? So there was a feedback loop in your endocrine system. So it thinks you're pregnant. Your body thinks it's pregnant.
And it eats up the fat.
And it eats up the fat. I don't get that.
You'd have to research that one.
Yeah, okay. Okay, what about coconut oil? How many people are using coconut oil? You are? Okay, here's a woman who's using coconut oil. How much do you take a day?
I don't use it daily. I mean, I have it there,
Uh-huh.
and the thought is that it really is supposed to help with feeding the brain that is probably
Yeah.
diabetic. You know, so it gets
Like the brain is diabetic, and so coconut oil feeds the brain. Anybody heard about the woman who treated her husband for Alzheimer's disease with coconut oil? Dr. Nelson. And she gave him between 5 and 7 tablespoons of coconut oil a day, and he improved. I mean, dramatically. She's written a book, and the research can't document that it stops any brain shrinkage or anything related to the brain, but this woman swears by it, and other people have started using it for the same reason, to improve their cognition. So if you thought you were losing your sense of smell, are you likely to buy a little coconut oil for yourself? I think I would. I was going to tell you a secret, but I'm not going to tell you. Okay, and then another food fad is raspberry ketones. So according to a study of rats, raspberry ketones can cause weight loss. We're always looking for the weight loss magic bullet. So, but we don't know if it can in humans, so hold off on the raspberries. Is a gluten-free diet a cure for joint pain? If it's related to celiac disease, she says. So, not according to nutritionists, it's not a cure for joint pain. A lot of people are using gluten-free diets as a cure-all. It's a very popular movie star diet now. Russell Crowe swears by it. So if you like Russell Crowe and you like his movies, you might want to try a gluten-free diet. You see it in the store. I mean, it's very prominent, all the gluten-free foods. And should an elder supplement with protein powder? Yes? Okay, say more.
Elderly eat less, they don't have good body mass, their protein intake is low, and so it would have a positive effect on their body.
Okay. Anybody disagree with that? She said yes, they don't eat well, they don't have as much muscle mass, they need the extra protein, so use protein powder. It tastes terrible? Some of them taste terrible. They're pretty expensive. if you look at the size of the containers that you can buy and the price, it's really expensive. So a lot of elders are living on fixed income, so consider that. If they're nutritionally in poor shape, you may want to, but I'm not so sure on an everyday basis you would want to. Because what if they have some kidney damage? A high protein diet wouldn't be very good for their kidneys, and so you want to be careful. Maybe some, but not too much.
Mix it with chocolate.
Mix it with chocolate. There you go. It might cure your kidneys because your hypertension will be lower if your kidney disease is caused by hypertension.
There's some rice ones, and there's some geared towards vegans and stuff, so you can look around.
Okay, so look around. Don't just go to Walmart and buy a container of whey protein. I think that when you have elder patients who are healing from surgery or in general, they should have more protein because, as I said, they're more likely to grab quick foods like goldfish, whatever is handy on the table nearest them so they don't have to get up and go to the refrigerator. So maybe you want to teach them to also add things like a turkey sandwich, an egg, Ensure. Maybe that's expensive too, but maybe for people with healing problems, sure. Okay. And hope their family doesn't eat it. All right, physical activity. I call it physical activity and not exercise on purpose because to me exercise is something very routinized. You plan it, you go someplace special to do it, you wear special clothes to do it, you need special equipment to do it. It's not something you can just do, like walk out your door and do. Whereas physical activity means to me moving around in the normal course of the day, doing your chores, your yard work, you're washing windows, you're washing the car, and you're not really planning it, it's just happening. But when I went into nursing, I really loved it because it was so physically active. I was on my feet for 8 hours. That was when we had 8-hour shifts. I was moving around all the time. I was lifting and turning, and I was in very good shape. But now, everything is different. Now that, I went ahead and got too much education, I sit in front of a computer most of the time. And so I don't have a physically active lifestyle, and it's not good. So I have to think about exercise every day and what I can do. And I think when you get older, you lose your motivation. You're tired. Maybe you're apathetic or depressed, or maybe your cognition isn't very good and you can't even plan how to do it. If you lose that frontal lobe, you can't really plan a sequence of steps to reach a goal. So it becomes impossible to do that. So there are some ways to think about promoting physical activity, and we're going to talk about that. So I always ask people, how active have you been since I saw you last, when I visit people? And if they say that they haven't been active or very infrequently for about a month or more, then we start talking. Like, would you like to be more active? And if they say yes, but I don't know if I can, then you might want to ask them why they think they can't. They could probably tell you, unless they're demented. And this is just an example of a discussion with a patient that is positive instead of saying, oh, you got to walk, you can't stop. And often we hear now from our physicians, take exercise, do exercise every day, do 30 minutes a day. Well, how? How do people know what to do? I mean, they don't. They don't know how hard to go. They don't know how they're going to fit it into their schedule. So we have to talk more in depth with our people to help them become more physically active. So you can use a 7-step approach in your physical activity counseling with your patients. You can first give them some education about the benefits of physical activity. It reduces cardiovascular risk. It improves cognition, especially aerobic exercise improves cognition. It improves mood. It's very good at reducing depression, better than antidepressants in some cases. What else about exercise? Makes your body look better, makes your body feel better, makes you more flexible, stronger. The endorphins. So it promotes that overall wellness that people like, that feeling that people like. You need to pre-screen elders for exercise. You need to ask them questions that would indicate disease or symptoms that would lead you to wonder if they needed further testing before you sent them out to exercise. So you ask them questions about dizzy spells, about have they fallen in the last year? Have they fallen in the last month? So you want to find out how many times they're falling. Do they have any chest pain? Do they have any tightness in their chest? Do they ever feel like an elephant is standing on their chest? You know, have they ever had that kind of discomfort? If they have, it's an indicator of heart disease. Women often get pain down their left arm and pain in their jaw or pain in their shoulder blade when they have a heart attack rather than that chest pain. But overall, women also get chest pain more often than those other symptoms. So if you find out that they're dizzy, have symptoms of heart disease, or have had a stroke or fallen, you want to be careful how you recommend physical activity. You want to be able to do a physical activity assessment and to know their ability. One of the things you can do is a single limb stance, where you have them stand next to a chair so they have something to hold on to, and you have them raise one leg at a time, and you see how long they can hold it. So if they can hold it for 30 seconds, they're good on their balance. Then you have them do the other leg the same way. Again, time it. If they're good for 30 seconds, then their balance is pretty good. Mine isn't very good, so that I could do that in front of you was amazing. I think I was too scared to fall. You can also do a 6-minute walk test. Of course, this is more research-like, but you can see what their gait speed is like. You can ask your patients to walk across the room and see what their gait speed is like. Slow gait speed is associated with a higher rate of mortality within the next 5 years than a faster gait speed. So if they're slow, or you can see if they're tippy, then you want to be careful what you recommend and how you recommend it. Anybody wear those sneakers that do this to you? Do they work? No? Somebody got sued for saying that they did work. Who was that, Skechers? Well, I've seen some elders wearing them, and I don't know. I think it's tricky if you're not well balanced to wear those sneakers. So good shoes. You have to really find out if they have the right kind of walking shoes. My mother-in-law walks in little girl shoes, little girl flats, and I don't know how, no socks. I don't know how she does it.
How far does she walk?
A lot. She walks a lot. She doesn't own a pair of sneakers that I know of. I don't know if she can bend over to tie a sneaker. So that's a consideration. Maybe they need Velcro. Velcro shoes. So you can tell how old somebody is by looking at their shoes. I was just wanting to see their shoes. If they have Velcro, you know. They've passed the gate. All right. Can you think of other things you'd want to pre-screen for? Blood pressure, orthostatic hypotension. How about take their blood pressure standing and then, take their blood pressure sitting after they've been sitting for 5 minutes, do it accurately, and then have them stand up with the cuff on their arm and take it again. And if it shows a drop, then they have orthostatic hypotension, are more likely to fall. And there are special ways of measuring how much orthostatic hypertension they have. So you know, you have to kind of calculate the difference between the diastolic and the systolic, sitting and then standing. Anything to add to that? Dizziness. Okay, we had dizziness on that first question. Have you, you know, but dizziness. Okay, good. And are they dizzy when they stand up for you to take their blood pressure? Because that's a good sign as well. Without goals, we achieve nothing. So you want to help them set some goals. And you want them to set realistic goals. Okay, I'm going to start walking an hour every day this week. No, it's not going to happen, probably. Especially if you're older. And given pain, which many elders suffer from arthritis and those conditions, rheumatoid arthritis, osteoarthritis is more likely the culprit. Heavy exercise will cause them more pain. So how do you teach someone with osteoarthritis to exercise? How? Say? Low intensity.
I mean, like, water's best because
Okay, so aqua aerobics or water exercises. That's true. You have to get them in the water too, but you have to find a place that does water aerobics. A lot of them do now. And there's a whole program that the Arthritis Foundation has set up for, you do? Yeah, you do. I know you. There you are. You look different today. Did you go out party last night? Uh-huh. I thought you looked a little.
Secret, did you not understand? No, we do have the aquatic classes, and it's a heated pool, so that helps too.
Yes. She's the director of the Bob Ross Senior Center over behind the VA hospital. And they have wonderful aquatic classes. And the elders love them. They really love them. And you can see them striving to do the exercises the way they're to be done, but some of them can't. Some of them have dementia, some of them are physically unable, they're compromised physically, but just getting in the water does something to them. You can see it in their faces light up, they're happy. It's a great place, Bob Ross. I miss going there. Yes, and that's a good point. Having to go somewhere special to exercise makes it harder. And then you have to take your bathing suit, and you have to remember your towel, and you have to take your underwear and your clothes and your shoes. Yes, it's harder. I went to the gym one morning and I forgot my towel. I had to go take a shower and dry off with paper towels. It was a challenge. I thought, oh my God, I need to be tested.
Should have stood underneath the blow dryer.
Yeah, I could have just. Yeah. That would have worked. And I think also when you're setting goals, remember that if people haven't been exercising, they should only do about 10 minutes to start. So just getting out of the house and walking down the driveway to the mailbox, maybe a couple of times. One thing about San Antonio is there aren't many sidewalks. And so walking can be pretty tricky out in the road because of traffic. And also, you know, if you're walking on the side on people's lawns, there may be a ditch there for rainwater collection, but also it may be rough and it could cause you to slip and fall. I know a lot of women I've worked with haven't wanted to walk in their neighborhoods because of dogs. And I found this especially true in poorer neighborhoods where safety was always a concern for other reasons as well. So you have to account for those kinds of environmental things because all of health behavior occurs in the community. And so if we can develop ways of addressing community barriers or community facilitators to exercise, then we can help the person overcome those. And the heat. And the heat. And if you don't love heat, it's hot here. It's not a place to be, especially in-town heat. I've noticed the heat in San Antonio is much worse than the heat where I live, which is out in the country, because there's more green. There's more green stuff, and it reduces the heat, and more open spaces to let the wind come through. But downtown, man, that river walk, woo, it's hot. Yeah, say, dirty water, the river walk? Yeah. You're not going to go drink it, are you? Don't worry about it. A lot of people feel that way about the San Antonio River. My father-in-law is one of them. Okay, and then should we be role models? Are we really professionally responsible for being good role models for our patients? Should we talk about what we do with our patients? Should we be that transparent? I think we could. I think we could talk about how hard it is. We could sympathize and say, I have trouble too, to get that connection. When I did my work with women in exercise, I asked them about the history of their exercise, why they started, when they started, why they stopped, to find out what happened in their lives to make them stop. Are you yawning? And childbirth is a very big life event that causes women to stop exercising. Marital problems are a huge event that create barriers. Working women who have families and need to come home and cook. I mean, after work is a very popular time to exercise for most women, but you can't because you have to get home and pick up the kids from daycare and cook a meal, and then by the time you get everything ready for the next day, it's too late. You can't do it unless you have something like an elliptical machine in your bedroom, but are you going to have the energy to do it? And who wants to be in their bedroom on the exercise machine when they could be in bed with their spouse? Right? Or not a spouse. You know, maybe you're a single parent. or maybe you have a spare. Okay, so the next time you see your client, they come in and they say, well, I've been walking 10 minutes a day, like you said, you know, and actually I've been able to work it up to 15. And that's okay. Anything is better than nothing. Anything. So you give them verbal encouragement and feedback and rewards. Incentives work. I don't know what you could provide a patient as an incentive except your clients, except your, you know, your expression of awe that they were accomplished. It's such a big deal, you know, that they managed to do that. And I think that kind of respect that you show them for how hard it had to be will really go a long way. She's yawning too. Many workbooks have been created to address physical activity barriers so that people can sit down and figure out how to manage time, money, motivation to be active. And you know, they're all created based on the trans-theoretical model. Are you familiar with the trans-theoretical model? It's the one that motivational interviewing is based on. It's the one that has the stages of change and the processes of change. So in the first stage of change, you haven't even thought about exercising. And until you bring it up, that's why education is the first step in that counseling. Until you bring it up, they're not going to have any idea. They won't bring it up. They won't even think of it. It's not part of their circuitry yet. So that's called the pre-contemplation stage. And if you continue to work with that client, you will get them to the contemplation stage where they now are really seriously considering physical activity. And then finally, the stage where they're trying it out. So between pre-contemplation and really trying out physical activity may take you 6 months, but it will work. And maybe you have staff in your office who can call people, because those kinds of cues really work. If you send a card, if you make a telephone call, and remind people of what to do. People who believe in themselves are more likely to do things because they believe they can do them. People who have friends who do physical activity are more likely to be physically active. And the women I found insisted on having a group of others with them when they were active because they couldn't really do it for themselves. They felt too pulled by their families, but if they knew a friend was going to show up, they couldn't let her down, so they would go out. Here's the activity pyramid for people over 60. So sitting for more than 30 minutes at a time, because who wants venous thrombosis, and watching TV. But you know, needlework and crafts are really appealing to many elders. I just took up quilting. I can't believe it. I never thought I'd want to put little bitty giblets of fabric together. But I did, and I won first place in Best in Show at the Kendall County Fair. So, but it was hard work and it took 2 years. So sitting less, and throughout the week, just becoming more conscious about being active, carrying something around the house when you walk. A bag of rice fits nice in the hand. You don't have to buy weights or a can of something. Of course, don't drop it on your toe. Tai Chi is very good for balance, demonstrated over and over again through research to be good for balance. Aerobic activities are important, like walking, dancing, and water aerobics. And when you do water aerobics, it can be really challenging, really demanding. So the person has to find the right instructor in the right class. It can be too much for some people. Any of you ever go to a gym and everybody's young and they're able to, what is it called when you pedal a bike really fast? Spinning. I tried that once. I could not keep up with the people in the room because it was too hard. When you reach a certain age, your heart just won't beat that fast. It won't. It won't. And then every day, do some chores, walk around. I always feel better if I just walk around a little every day. All right. So how do you teach your clients what target heart rate they should reach when they exercise and how to do it? So there are 3 ways to measure intensity. One is target heart rate, and I gave you the formula. So you subtract your age from 220, and then you multiply what you get by whatever percentage intensity you want them to start with. I'd say 60% because it's light. So you multiply it by 0.60, and that should be the heart rate they reach when they're exercising, and they can use their carotid artery as a way to count because it's easier to count there than on the wrist. They can count for 10 seconds and multiply by 6. And in heart rate reserve, you subtract your resting heart rate from your maximal heart rate. And how do you get your maximal heart rate? I didn't say that word, but 220 minus your age is your maximal heart rate. So the older you are, you can see the less your maximal heart rate. And then you get heart rate reserve and multiply it by 60 or 70% for the training rate. 5 minutes, okay. And then the rating of perceived exertion on a scale of 6, being not at all difficult to 20 hard as imaginable, you want them to start about 11, 10, 11, 12, and move on up to 14. And you can find this rating scale on the web. You can give them out to your patients. 10 to 12 light, after a month move to 13 to 15. So moderate intensity is 11 to 14, which is 3 to 6 METs. And a MET is the equivalent, is the amount of oxygen you use equivalent to sitting in a chair. You're just sitting. So that's 1 MET. So 3 to 6 METs is more. I have found that most people like to go about 3.5 to 4, the older adults that I have been training in exercise. And then vigorous, I don't think you're going to have an older adult that can do that, except maybe that guy that's in those airplane ads that has a six-pack and he looks about 90 years old. Have you seen those ads? Senegex or Sengenex? So he might do that, but I think he must take growth hormone. What do you think? Remember that exercise is the major treatment modality for diabetes, and walking is it. Everything's going to be moderated. In fact, in a study at NIH, they found that exercise changes the physical activity changes the gene that causes diabetes, that actually reduces your risk. So walking reduces your risk. Remember, people with diabetes, you can't use the target heart rate because usually they have some cardiovascular things going on. They might be on beta blockers. So you have to use the Borg rating scale or the heart rate reserve formula. And people with peripheral neuropathy who have diabetes can do water aerobics, weight training, and biking. I can't imagine how bad peripheral neuropathy would be. So people should be doing 3 different kinds of exercises all the time. Flexibility, that's stretching, and those are some activities that do that. Endurance, which is aerobic, which is walking, running, household chores, vacuuming, heavily vacuuming, cycling, skating, swimming is very good. And strength, which is muscle training. And they don't have to use weights. They can use their own body weight as resistance. This is also very important for preventing osteoporosis. Doing sit-ups, push-ups, climbing the stairs. Anybody have stairs in their house? I have a huge flight of stairs that I go up 5 or 6 times a day. It's the only way I am not 200 pounds. The routine is you warm up, you're active for 30 to 45 minutes, and you cool down. And you don't have to do every type of exercise every day. You can do endurance one day, flexibility one day, strength training one day. You can mix and match. You can do a little of one and a little of the other. It doesn't matter how you do it, as long as it's done. And here are some information sources for you. This is a physical activity listserv you might be interested in. The PACE project means Physical Activity Counseling and Education. It was designed for physicians in primary care practice. You can't find the questions anymore. Well, you can find them, but it's copyrighted now. You have to buy the stuff, which I think is a sin. And then here's information on the trans-theoretical framework. The CDC has a lot of information. There's an active aging website at Texas A&M. I'm kind of jealous about that. Kind of wishing I were an Aggie. No. And then the National Institutes of Health. For example, the National Institute of Aging has videos, booklets, all kinds of things. And the American Sports Medicine Group is there too. They have a lot of publications. Many of the items that you need are found in Spanish, especially at the National Institutes of Health. So, any questions? Yes?
What place or what role, if any, would you have for power plates?
For what?
For the power plate devices, exercise without having to walk.
Those things you see.
Power plate devices.
Yeah.
High vibration devices that you can stand on.
And they shake you? Yeah, I've seen ads for them. They were popular when.
For a long time, actually.
Yeah, well, I remember them from when I was a kid. You know, women would buy them and put a belt around their waist and it would shake them, that kind of thing.
Well, they're kind of expensive. Some of them run $12,000, $5,000, whatever. They actually, you stand on them.
You stand on them.
And exercise your
Well, you know, the Wii is a very popular exercise item. I don't know much about the Power Play, but the Wii has a balance board that you can use. It actually calibrates your balance. There are tennis games, golf games, all sorts of things. I would recommend the Wii. It's kind of pricey, but senior centers might get one.
We have
You have them. Okay, good. Good. Anything else? Thank you.
Well, there we are. We are now at time for a break. As you break now and also for lunch later, the vendor tables are out and around. These people have helped support this through their contributions to being here, so we encourage you to at least stop by and thank them and also take a look at what they have to offer. We will be back at 10:30 to kick things off for the next session. Thank you.